Good afternoon, everyone. My name is Ramya Jodamraju, and I am an analyst of chronic disease prevention at ASTO, the Association of State and Territorial Health Officials. Welcome to the first of the two-part TCN Virtual Town Hall series. Before we get started, I would like to overview the logistics for this afternoon's virtual training. Please plan to join by Adobe Connect platform and by the phone line for the entire virtual event, as audio is not available via computer speakers this afternoon. This virtual event is currently being recorded, and a link to the recording and virtual training slides will be sent to you via email next week. The recording and slides will also be made available on the TCN website in the next week. We invite you to participate in this afternoon's question and answer session by typing your questions into the on-screen chat box at any time during this afternoon's presentation. Phone lines will be muted for the duration of the town hall. This Town Hall series will focus on the impact of current smoke-free policies from a health equities viewpoint. Today, we have Veronica E. Helms, a social science analyst from the U.S. Department of Housing and Urban Development, who will discuss cigarette smoking among HUD-assisted adults. Just a reminder that the TCN mission is to improve the public's health by providing education and state-based expertise for tobacco prevention and control at the state and territorial and national levels. Veronica, I will hand it over to you whenever you're ready.
Fantastic. Thanks for that introduction. And I'm excited to talk with you guys today. So I'm going to be talking today about cigarette smoking among HUD-assisted adults. I'm going to try to take kind of the health equity lens. And then when we close out, I would kind of love to discuss any opportunities for collaboration or any way to kind of move forward with some of the research that I'm going to discuss today. So thanks again for joining, and I will go ahead and get started. So I'm first just going to provide some background, and then I'm going to talk a little bit about the research methodology very briefly, and then I'll cover some results that came out of some papers, and then again followed up with some discussion. So just some background. I'm not sure how familiar everyone is with the U.S. Department of Housing and Urban Development, but our mission is to create strong, sustainable, inclusive communities and quality, affordable homes for all. It is possible that mission statement could change, but generally the goals would continue to stay the same. So currently our 4 strategic goals for up through the fiscal year 2018 are to strengthen the nation's housing market, to meet the needs and really promote affordable housing, to build strong, resilient, and inclusive communities. And then the last one, which is where the bulk of my work falls into, is to use housing as a platform to improve the quality of life. Now, I will say that within HUD, I sit in the Office of Policy Development and Research. We're about 140 researchers that provide support to the entire agency on any sort of data or evaluation or economic needs related to program offices or programs. And at HUD, I specialize in health and housing research. So I just want to kind of presented that in the sense that I will be speaking from a research point of view today rather than a programmatic view. Now, I know that typically when I talk with health folks, this is not a case that I have to make. It's often with the housing people that I have to make this case, but we really know that housing is a key social determinant of health, especially when you look at Healthy People 2020. They kind of put these 5 buckets as the key social determinants of health, and I kind of always like to frame housing by saying that it really falls into all 5 of those buckets, because where you live is where your kids go to school. It's how you can access emergency care, urgent care, primary care, what kind of resources you have. Regarding economic stability, obviously how much you spend on rent really impacts the rest of what you spend for other needs, such as food or medical costs. Social and community context, whether you feel safe in your neighborhood, whether the physical structure in your neighborhood is good, and then obviously the one that housing mainly falls in is this kind of neighborhood and built environment bucket. So again, I know that for health folks, I don't really need to make the case, but from my frame of reference, often speaking to housing audiences, I often have to kind of make that tie of, all right, how is housing relevant to health? So I normally like to frame it in that point of view. So if we want to talk about HUD Housing Assistance, HUD currently provides housing rental assistance to about 10 million folks every year. And this includes about 4 million children. So about 40% of all of our residents are aged 0 to 17. And one of the things I really like to highlight about housing is that it's not an entitlement. So it doesn't serve everyone who's eligible. And actually our estimates say that only about 1 in every 4 households that are eligible for assistance actually receive assistance. So unlike a lot of the other social safety net programs, our stock is greatly reduced and we can't serve everyone that needs it. And because of that, a lot of times housing agencies will prioritize certain groups for assistance. So elderly and disabled persons make up over half of our tenant households. And they, again, going back to that economic stability thing, we know that housing expenses really crowd out other expenses. And this is the point of view that we try to take with housing assistance. In order to be eligible for housing assistance, really the 3 key things that a household has to qualify by is citizenship, gross income, and then household size. So I'm just going to kind of briefly describe our 3 largest programs. And again, if you have any questions and you want to type into the chat box, I'm happy to answer as I go, because sometimes these explaining these housing assistance programs can be a bit confusing. So public housing is typically the program that folks are the most familiar with. It's federally funded, but it's regulated by local housing authorities. And assistance is project-based, meaning it's a specific unit that when you receive assistance, you say you're going to move into building Y in unit X. And it's not really transferable. It's tied to a specific unit. Conversely, there's the Housing Choice Voucher Program, which is sometimes referred to as the Section 8 program, although that terminology can be a bit loose because it only refers to the legislation that created the program, but Section 8 typically refers to the Housing Choice Voucher Program. And this is a different program in the sense that the rental assistance really lives with the tenant. So the tenant is approved for a certain amount, and then they're responsible for leasing up. They're responsible for finding a housing unit that will accept their voucher, that meets program demands. But this program is great in the sense that it gives a lot more independence for the family to be able to choose where they want to live. So it's more of a payment so that folks can obtain housing on the privately owned rental market. Now, the last one I'll talk about is called multifamily housing. Again, this was also created under Section 8. So sometimes this one's also called Section 8, but it's very, very similar in public housing where it's a physical unit. So when you receive multifamily subsidy, it's tied to a specific unit. The biggest difference between multifamily and public housing is that multifamily is a contract between HUD and the owner of a development. So if the tenant moves, the owner is still receiving assistance. Conversely, public housing is managed at the local and state level rather than between a building owner and a contract directly with HUD. So just how the money kind of funnels through is different in each of these programs. So, my slides are space is a little off, but that's okay. So I wanted to talk a little bit about the history of tobacco control in HUD housing, which is obviously the focus of this group here. And I will say that Josh will share a link for HUD's program office of Healthy Homes that kind of manages the programmatic aspects of smoke-free housing. And on there you can find a lot of the documents that I'm going to talk about in this next few slides. So it really kind of dates back, it's almost embarrassing to say as a public health professional that it only dates back to 2009. So kind of the first effort from HUD was started in 2009, and it was a notice to public housing agencies to adopt smoke-free policies in their properties. And it was more of an encouragement at that point. It was saying, hey, there are a lot of benefits here. We really think you should start promoting this. So that was in 2009, and it was reissued in 2012. In 2010, the original publication was followed by another notice, which encouraged, again, not just public housing, but multifamily development owners to kind of adopt these smoke-free policies. So the way that HUD is situated, their multifamily and public housing are managed by different entities. So when we kind of push out these rules or these suggestions, they have to go to each of these groups through separate mechanisms. Then in 2012, again, they reissued the rule that was in the beginning that I talked about in 2009, and then they also published two separate smoke-free housing toolkits that targeted owners as well as housing agencies and residents. So I think there was definitely a realization of you can't just give this rule and then not provide any support. So these toolkits are really meant to kind of help answer a lot of questions that have been coming up regarding smoke-free policies. So in December of 2015, HUD published a rule to make all federally supported public housing properties smoke-free. Now, again, I will highlight that this is only for public housing. It doesn't account for that multifamily housing category, which is pretty large, or housing choice vouchers, because they're obviously chosen by the recipient or the resident. In October of 2016, approximately 676 housing agencies had adopted smoke-free policies for at least some of their properties, so not all. And I will say that there's about 3,300 housing agencies total, so just to kind of give a frame of reference for what that 676 number looks like. And it was estimated that the policies covered about 250,000 units and about 500,000 residents. So again, still we're kind of at this point starting to make a dent in that 10 million folks that we serve. And finally, in February of 2017, HUD finalized the rule requiring all public housing agencies to prohibit the use of lit tobacco products in and around their properties within 18 months. So again, this is currently being implemented, and we're certainly learning and evaluating as we go. So I will say that when I first started at HUD, I'm one of the few kind of health and housing folks in the building, and I again tend to be more research heavy. And so when we first kind of started putting together the regulations for this rule and talking about how we were going to support the rule with our partners, one of the first questions that came to our office, the Office of Policy Development and Research, was, what is the prevalence of smoking among HUD-assisted residents? And I will say, sadly, until recently, we did not know. We had no mechanism to really make that estimate because as a non-health agency, we're not doing health surveys. We can't collect any information on forms that aren't considered to be administratively necessary. And so one of the things I was tasked with was working on a data linkage with HHS to link their health survey data with our HUD data to really kind of start to answer some of these questions. So I'm going to talk really briefly about this linkage, just so you kind of understand where a lot of the research numbers I'm pulling from are, but I'll try not to go kind of too deep down the rabbit hole into the methodology. Oh my gosh, it cut off all my first letters. So I'm sure most of you are familiar with the National Health Interview Survey. It's one of the largest public health surveys in the country. It's cross-sectional. It has a broad range of health characteristics. It samples the civilian, non-institutionalized population, and then it's conducted and released annually. So it has a really robust nationally representative sample. So again, our HUD administrative data is collected either through the housing agency themselves or through a private owner who will submit paperwork through HUD, but either way it gets kind of funneled up to us. It's just a mechanism to how it is submitted. So again, it's either submitted by the local housing agencies or the private buildings. We have really, really detailed income and geographic information, but we have limited socio-demographic information. And again, the three housing rental assistance programs are public housing, HCV, and multifamily housing. So this is kind of the boring stuff, but the linkage eligibility, we only wanted to focus on people who had enough information to be linked, on those who did not refuse linkage, those who do not refuse to answer a question about housing rental assistance, because we assume if you don't want to answer that, then you wouldn't want to be linked. And it was based on first name, last name, SSN, sex, and date of birth. And then we kind of took that data and we created episodes to kind of identify who was in HUD housing at the time of their health interview, and we call those folks concurrent. So if you look at kind of this little arrow diagram at the bottom, we have the whole universe of everyone who answered the survey. About half of them were actually linkage eligible. About 10% of those ever linked to HUD records. And then when we looked at actually the timing of their HUD assistance in the survey, our final sample were those folks that were HUD concurrent. And when you download the PDF of the slides, there's also a link to more information about the data linkage if that's just something you're more interested in learning about. So from this data, me and some colleagues from the CDC produced kind of two reports, two papers that looked at cigarette smoking among HUD-assisted adults to really support the smoke-free rule, to help describe what the characteristics are of current smokers and a number of other things. So the first paper, which actually just came out last month, it's more of a data brief, and it was published in a CDC journal called Preventing Chronic Disease, I believe. And it's called Characteristics and Correlates of Cigarette Smoking Status among U.S. adults receiving federal housing assistance. And if you look kind of in the files, it's the one called Wang et al., because the first author was my colleague at the CDC. So for this paper, I keep calling it a paper, but it was certainly more of a data brief. We looked at the patterns of cigarette smoking of current, former, and never by sociodemographic, household, and chronic disease characteristics from a sample of about 4,700 adults. And again, a lot of these data is pretty rudimentary in the fact that it's just prevalence statistics, because it was kind of a first step for us. So we see that about half of our smokers, or half of HUD-assisted adults, were never smokers, about 33% are current smokers, and about 18.6% are former smokers. And I realize that the interesting part to this group is likely the current smokers. So I'm going to talk about that in the second paper. So we see that former and never smokers comprise the majority of HUD-assisted residents, about 67%. But the one thing we really wanted to highlight in the paper was that these folks are still susceptible to secondhand smoke, because some prior studies have found that about 1/3 of multi-unit housing residents who prohibit smoking in their personal units still experience kind of incursion of secondhand smoke. We also found that smoking status varied by the number of chronic conditions, even when we stratified by age. So again, we see that whether you were a current, former, or never smoker varied again by the age category. Again, nothing new for this group. We have plenty of studies to say if you were a current or former smoker, you're more likely to have chronic disease. But we really wanted to kind of quantify this for housing stakeholders to say, this is where we can really address kind of a health equity issue and see if we can make a dent in it. So moving on to the next paper, and this one was a full paper versus a data brief, so it had a lot more information. And this is the one in the file called Helms et al. And this is cigarette smoking and adverse health outcomes among adults receiving federal housing assistance. So again, this was the first to kind of assess the cigarette smoking prevalence, the smoking behaviors, and the adverse health outcomes among a national sample of low-income adults who were HUD-assisted. So the first thing we found, which I highlighted in the prior study as well, is that approximately 1/3 of adults receiving HUD assistance were cigarette smokers, and we know that it hasn't really moved for low-income persons. That prevalence rate hasn't moved for low-income persons like it has for other groups in the United States, and we really wanted to point out that, HUD-assisted folks are groups that could really be targeted for kind of smoking cessation assistance, because we do see that smoking is really prevalent among our population. So again, this rate is nearly twofold higher than smoking rates observed among the general adult population, and it's also pretty consistent with some other low-income populations when you just isolate low-income folks. So we also saw that when compared to non-smokers, HUD-assisted adults had greater odds of reporting fair or poor health, COPD, disability, emergency room visits, all of these kinds of all these kinds of outcomes. I think that we looked at, if I remember correctly, 10 or 12 outcomes, and 8 to 9 of them had greater adjusted odds. But again, nothing new, just more wanting to quantify the fact that folks that were smokers in our properties were experiencing greater odds of all of these health conditions, and really trying to make the case for our leadership. So regarding cessation, we see that over half of current smokers attempted to quit during the last 12 months, and this was something that we really wanted to grab onto because, as you know, a lot of the naysayers say, oh, well, people don't want to quit smoking, and especially low-income people, and we really, really wanted to make it a point that just simply wasn't true among our folks. We had seen that I think 53% had tried to quit but weren't able to quit. And we really wanted to highlight, especially among our quit line partners, that there are some really unique environmental and clinical challenges to dealing with folks in HUD-assisted housing. For example, you have a greater exposure to smoking. It's a social thing, especially if you live in a large unit or a large building with lots of properties. And then also stress levels, elevated stress levels, because when you're in this kind of low-income situation, and even though you're receiving housing assistance, we do see from some of our other research that you still have high rates of food insecurity, you still have a lot of trouble paying the bills, so it just kind of highlights this population. And then lastly, we just wanted to point out that it's important that HUD-assisted housing residents be provided kind of sufficient access to cessation resources and support. And the Office of Healthy Homes within HUD has really been making a lot of effort to connect with partners so that housing providers and owners are really kind of tapped into this. Because, again, even though housing and health, there's a clear connection there, a lot of the housing providers, you really have to kind of form these relationships, because a lot of times it doesn't make immediate sense to them as to what the connection is between housing and health. So when we looked at the characteristics of HUD-assisted smoking among current smokers, we saw that about 80% were daily smokers, and about 70% reported smoking 10 or more cigarettes a day. So we just wanted to highlight this as the potential for secondhand smoke incursion, as well as exposure to children and other vulnerable subgroups. And I will say that one of the other studies that I'll briefly highlight, so you guys will see in the files, there's a document called Health Picture of HUD, and that is a report that we use this data to describe kind of a general health picture of HUD-assisted adults. And I bring this up because we also have a companion piece that's a health picture of HUD-assisted children. And we see that even when we compare to low-income children that are in renting households, that HUD-assisted children have really high rates of asthma. So we've been really trying to figure out if there's a way that we can link those high rates of asthma to secondhand smoke, or whether it's more of kind of a mold environmental thing, whether it's all of it. So I just wanted to highlight that those resources, we're kind of starting to dive into those questions. So I will also mention that it was really important to our CDC partners that we also kind of highlight the economics of the issue, and that kind of these smoke-free policies in assisted housing can have really compelling economic impacts. So some estimates have estimated that we would save approximately $500 million, including $300 million in secondhand smoke-related healthcare costs, and millions in renovation expenses, and that it would really kind of help reduce fires and renovation, as well as kind of some adverse health costs. But that being said, excuse me, if in your jurisdiction you have any compelling data that would kind of help us to make the case for these renovation costs or anything like that, we would be really, really interested in exploring that. So please do reach out if that's something you do have. So finally, I just kind of wanted to highlight that renters and residents really kind of do, from prior research, prefer smoke-free environments, and that these policies have the potential to really reduce health disparities, to reduce those costs, reduce fire-related injuries and deaths, and kind of full circling back to the HUD mission to improve the quality of life for HUD-assisted households. So I see I have about 5 minutes left. I wanted to wrap up with discussion and allow folks to answer any questions they might have. So to bring it kind of back to this health equity and disparities issues, we see that cigarette smoke and kind of related adverse health outcomes are really prevalent among our HUD-assisted adults, and that we really need to kind of find a mechanism for continued surveillance. And I will say that the rule I was speaking about was strictly for public housing, and a rule hasn't been kind of put forth yet for multifamily developments because they're independent entities. But I just wanted to highlight that these groups, often some of the biggest housing projects in the United States are multifamily developments, and so they could really benefit from kind of targeted outreach for tobacco cessation programs. So we really hope that this data kind of help inform the development, implementation, and sustainment of tobacco control policies, and to really kind of start to make a dent in this kind of disease or burden that we're seeing both among HUD-assisted adults and children. So kind of moving forward, I wanted to talk briefly about we're updating the data linkage. So the first linkage only went from 1999 to 2012. We're adding years 2013 to 2016. And kind of forward looking, we're going to do a linkage every other year. So we're hoping that over time, we're going to kind of be able to see a drop-off in current cigarette smokers within each of these programs, kind of as we start to implement these smoke-free policies. So that's just something to look forward to researching and hopefully kind of making that dent in the future. I will say that there is definitely an opportunity to work with partners. Again, I come from the research kind of framework, and I will say that we have been working with folks who have said, oh, we run a quit line, and we collect the address of the folks that are calling, and we would really like to use HUD data to say, okay, do these folks live in public housing? Do they live in a multifamily unit? And I've been kind of fielding a lot of those questions and helping to work with our partners on trying to figure out ways to use publicly available HUD data to look at a lot of these things. So if HUD is a population of interest in your jurisdiction, in your area, I would love to chat with you on how we can kind of use HUD data. Often the data is publicly available, and if it's not, we have research partnerships and ways that the data can be accessed for research purposes, and it's free. So again, please contact me if you have any questions about that. We're obviously working to figure out how to evaluate the smoke-free policies. And then lastly, just kind of find ways to collaborate to kind of move the health and housing agenda forward. So with that, I will close and answer any questions. I have my contact information below, and would love to speak with folks further if they have any questions about HUD data and how it can be used to kind of promote the work that they're doing. So thank you.
Great. Thank you, Veronica, for that insightful presentation. We have some time for question and answers, so I will be moderating today's Q&A session and directing inquiries from the chat box to today's speakers. So as a reminder, the phone lines are muted, so please utilize the chat box as we address questions. Our first question for Veronica is, how can state health departments help support public housing in the adoption of smoke-free policies?
That's a really great question. So we've done a lot of work on trying to build, or not to build, but to evaluate or assess areas where state health departments or federally qualified health centers have really made relationships with their local housing authorities or local housing partners. And we really have been wanting to study those relationships on, how do those relationships form and how do they, grow? And I think the thing that's been hard is that we see oftentimes when a housing agency and a public health agency have a really good relationship, it was kind of born from an organic, they were at the same meeting and they ended up chatting it up and figuring, oh, we serve the same population. How can we start to, kind of address the needs of these folks. So I think the hard thing is because those relationships have been organic, it's kind of been hard to create a roadmap for like, all right, how do you establish a relationship between with these housing folks. So I would say that definitely if you're at meetings where there are housing folks, I would approach them. I think for public health folks, a lot of times we see you have to approach the housing people at the state and local level with like a frame of reference that like they won't see it as a health issue. So I see a lot of times, like, when you approach housing providers, you have to really make the case of, like, you know, we serve the same folks, and our goal is to improve the health of low-income people, and you serve low-income people, so how can we help, and how can we really utilize this as a platform? So I would definitely say keep trying. I've heard often that, and again, we all work in social services to some degree, that a lot of times folks are just simply too busy, too strapped. So I would say certainly seek out folks that specifically focus on health. So I know that, like, in Washington State, the Housing Authority has someone that just works on health and education. So it's certainly a long game of building partnerships, and I know that's not a really concrete answer, but it's definitely kind of a long building relationships and partnerships kind of game, or at least that's what we've been seeing from our research.
Great. And our next question comes based off of a comment in the chat box, but what are some opportunities for collaboration and data linkages between state tobacco quit lines and HUD? That's
a great question. So I definitely think to just underscore the quit lines we've already been working with, and I know some of them have received some foundation dollars to kind of evaluate it. I think that if your state quit lines are capturing any sort of geography or any kind of personally identifiable information, such as first name, last name, date of birth, we can link with HUD Assistance. And so for research purposes, I think that there's certainly an opportunity to kind of identify folks in HUD-assisted housing that are making those phone calls. So, for example, if we're seeing a bunch of people from the same property are calling, then I think there is an opportunity to reach out to that property manager and say, you know, how can we kind of up our communication? How can we really kind of start to tailor many information if we're getting the same amount of calls from the same property? So I hope that answers your question.
Great. And so the next question is based off of the fact that the research that you reviewed is conclusive that the majority of HUD-assisted adults are never or former smokers. How should these populations be engaged as HUD properties adopt smoke-free policies?
So that is a great question, and I know something that a lot of families with children that are never smokers have been concerned about as kind of these rules are enforced. So I think that it's really important to engage the former and the never smokers about some equity issues that were really brought up by HHS throughout the smoke-free rule on if there are elderly people or there are people with disabilities that, you know, smoke in their houses because it's difficult for them to go outside, or it's difficult kind of mobility issues. I think there's kind of, I think we run the risk of when you think about enforcement or people like telling on other residents who are smoking in their house, I think that it's important to engage also the current and the never smokers on ways to kind of help with enforcement that aren't kind of building a rift in the community, if that makes sense. Because I think enforcement for smoke-free has been something that's really a lot of entities are struggling with. And I think it would certainly help to kind of engage all the populations on, like, okay, like, this is maybe why someone's still smoking in their apartment, and, like, how can we as a community or kind of start to address these and kind of build an understanding to both promote someone quitting, but also kind of accept kind of individual behaviors as they come, if that makes sense.
Great. The next question is, what are the best ways to make smoking cessation services available to assisted housing residents?
That is a wonderful question. So I would actually point you to the to the website that Josh had shared earlier, because there are some guides on kind of ways to reach residents. There's a lot of disagreement on this question. So as I'm sure folks know, a lot of low-income populations do still have cell phones. So there's because a lot of our population is either really young or really old, it tends to kind of depend on who you're trying to target, whether you're trying to target families with children or elderly folks. So I definitely would say it depends. So if you're looking at a property that's specifically for elderly and disabled, they often have care coordinators. So it would be best to kind of reach out to the care coordinators in those properties. But if you're talking about kind of families with children, then I think the best way is through texting or through kind of traditional public health campaigning. But I would, again, point you towards those resources because I know that they do address those. But to be honest, we're still trying to figure out what the best way to communicate with our residents are. Like, what we've sent letters, we've done text, so I think that's still kind of a work in progress.
Great.
And
another.
Oh, go ahead.
Oh, sorry. Go ahead.
Oh, no, I was going to say, I see that Sonia said that in Alabama Public Health they're working with the Housing Authority, and I think that's great. I think it always makes me really excited to hear that folks are doing that, so thanks for sharing that.
Awesome. So the next question is, how can the importance of smoke-free housing be framed to stakeholders who may not be persuaded by findings and language related to health equity and health disparities?
Oh, yes. So that's a really great question. I think no matter what administration we're in, there's definitely some soft points that we have to address. I think that now the terminology health equity and health disparities can sometimes be scary for folks. So I think a lot of times when we frame some of these difficult conversations with some stakeholders, it's important to really highlight the economics of it all. So especially for HUD-assisted housing, like that is government taxpayers, and when someone leaves a unit, we have to turn over that unit, and the cost to turn over a unit is so much more expensive. So I think that it's important to understand who you're talking to, but it's also important to kind of say, okay, what's the priority here? You know, for me as an individual, as a researcher, as a non-HUD person, I would say, okay, this is a health equity issue, but I think that sometimes when you're talking with folks, you have to say, okay, not only is this a health equity issue, but this is an economic issue, and this is a child health issue because of the secondhand smoke and the asthma. So I would definitely say be creative in the language you're utilizing, and maybe not framing it as health equity, but more as like not greater good, but as a child health and economic issue. But that's a good question. I mean, it's something that we'll struggle with, I think, for a while.
Great. Thank you so much. And that concludes our question and answer portion. Thank you again, Veronica. Those were all great and thoughtful responses. We really appreciate it. As a reminder, this virtual recording will be on the TCN website, tobaccocontrolnetwork.org, on the Resources tab. It will join the numerous webinar recordings, podcasts, and written materials that are currently available, all of which are designed to help state tobacco control programs and their partners address key tobacco priorities. We will be having another virtual town hall session on Thursday that will be related to historical and ethnic discrimination in smoke-free housing. We hope everyone has registered for this exciting second part of the series. As we wrap up, I would like to let you know that you will be directed to a survey at the end of this training. Please take a few minutes to complete the survey, as it provides TCN with some valuable input on how we can improve future virtual learning opportunities. We are especially interested in this training model, so we hope it's effective for future TCN events. This also concludes today's virtual session. Thank you so much, Veronica, for your thought-provoking presentation. I would also like to thank everyone from ASTO and the Tobacco Control Network who contributed to today's training. A recording of today's session will be sent to you via email next week and will be available on the TCN website. So any general inquiries about TCN can be sent to tcn@asto.org. Thank you and have a great day.
Thank you.